From June this year, Ghana will employ the use of drones to supply blood and other critical medicines to some remote parts of the country that are usually cut off when it rains.
At the 2018 Health Summit in Accra, the Vice President, Dr. Mahamudu Bawumia, said the agreement for this is almost complete, in addition to the purchase of 275 ambulances for every constituency in Ghana for universal health coverage in the country.
People have unfettered access to health services, including prevention, promotion, treatment and rehabilitation. Then universal health coverage has been achieved. This target is key in the SDGs Goal 3, which makes a bold commitment to end epidemics of AIDS, tuberculosis, malaria and other communicable diseases by 2030. Goal 3 aims to achieve universal health coverage and provide access to safe and affordable medicines and vaccines for all. These issues are at the heart of the 2018 Health Summit with the theme Achieving Universal Health Coverage. This stock-taking forum will also fashion out innovative approaches to achieving universal health coverage in Ghana. Financing, which is another key component in this effort, is a major issue, and members are expected to come up with innovative ways of mobilizing domestic revenue to finance healthcare delivery and involve the private sector. The forum will also review the performance of the various health sectors in the past year. In 2017, Ghana made strides in reducing poliomyelitis, reducing the rate of malaria, the payment of arrears on the National Health Insurance Scheme, reforms in National Health Insurance Scheme, and the expansion of CHIPS compounds. Health Minister Mr. Kwekwa Jimaimenu said despite the sector's challenges, some progress was made. However, areas such as maternal and child mortality need critical attention.
Achieving UHC is not just about fund mobilization. It is about efficiency in the use of scarce resources. We do not need additional money for all our activities. Domestic resource mobilization is going to be critical.
The WHO Regional Director, Africa Region, Dr. Matshidiso Moeti, said universal health coverage is not only critical in the health sector, but a key component in achieving the country's economic growth.
A recent study conducted in 2015 by the WHO Regional Office for Africa on the cost of ill health demonstrated a huge productivity loss due to ill health of an estimated 2.43 trillion international dollars by 2030 if the SDG targets are not met. For Ghana, the productivity loss was estimated at over 61 billion international dollars.
The Vice President, Dr. Mahamudu Bawumia, said it is a priority of the government to achieve universal health coverage. He pledged that the needed resources would be given to meet the target.
We are looking at ways, innovative ways, to deliver blood supplies as well as essential medicines to remote areas. As the rains come in, some areas are going to be cut off. Do we allow mothers to die because we cannot have blood supplies or essential medicines? So I'm glad to report that Ghana, I think this week, will be signing an MOU, and by the middle of this year, or maybe by September, we will join Malawi and Rwanda with using drone technology to deliver blood supplies and essential medicines. So we are going to do so this year, and the Minister is very much engaged in that.
Participants at the 2018 Health Summit are to develop a blueprint on how Ghana can achieve universal health coverage. They are also to come up with effective financial modules involving the private sector to support health financing to meet all targets in Ghana's health sector.